Hi guys, it's Dr. Galante. One of the major questions people have when they come in is they want to know, what's this going to cost? What's this going to cost me? Because no one wants any surprises, right? You don't want to go in, get some treatment, and 6 weeks later you get a big bill that you weren't expecting. So we don't do that. Everyone knows their costs before treatment starts. But be honest with you, it is difficult to answer that question, and I'm going to show you why. So the short answer is, what's it going to cost? Is I don't know. And the reason being is because I don't know what it's going to take to work up your problem as far as consultation, examination, x-rays, MRIs, lab work, to find out the exact cause of your problem. Once we find the cause of the problem, we put together a treatment plan for you if we can help you. And then we can determine how long it's going to take, what it's going to cost. So people call up on the phone and say, what's this going to cost me? We don't know. And all insurances are different too, as we'll explain here in a minute. So what I do want to show you is what happened if, say, if we went somewhere else. If you had, say you had some back problems, and you say, hey, I'm not going to go to the chiropractor, I don't know what it's going to cost, I'm going to go to the physical therapist. Okay, so we'll have a pretty good idea, we know what it costs. And the reason being is because I have some EOBs from a relative that went to a physical therapy. 10, 30-minute visits to the physical therapist was about $3,100. About $300, a little over $300 for every half hour. I don't know if you can see this very well, but this is a patient that came in. She brought in her treatment plan. She had some back and knee pain, went to a local clinic, and they gave her a $9,100 treatment plan with $3,700 out of pocket. And that did include some injections as well, but you're talking $10,000. Now, some people say, well, I'll just get an injection. I'll get a cortisone injection in the spine. Well, that can range upwards of $1,300, and it can last anywhere from not helping at all to lasting for a while. Most of the time, what a cortisone injection does, it takes inflammation down and people feel better for a brief period of time, days or weeks. The long-term success rate with a cortisone injection is very, very low, 15% over 2 years. So while it costs $1,300, long-term it's not really going to fix the underlying problem. Now, as we get into more invasive procedures, like spinal surgeries, well, obviously they can range from $50,000 to $100,000 with no guarantee of success and a high percentage of people needing surgery in the future. So we have 5 different types of patients that come in to see us. We have a cash patient. This is a patient with no insurance, and they come in and they pay cash. We have Medicare patients. This is obviously the 65 and older age group who have Medicare or some type of Medicare Advantage plan. We have personal injury cases. These are people, most of the time when I see them, they're in car accidents. They were injured in car accidents, and we're treating their injuries associated with their car accident. We have workers' comp, people that are hurt at work, and we're treating those injuries from a work injury. And the biggest number of patients we see are what's called PR or private insurance. So the cash patient has no insurance. It actually makes it quite simple. You're going to know your costs before we start treatment. You're going to know exactly how long it's going to take, what it's going to cost. Medicare is fairly cut and dry. They cover certain services. They don't cover anything else. So same story. We figure out what it's going to take to fix the problem, and we let patients know what their costs are going to be before we start treatment. Now, personal injury cases, if you have the right insurance, can often be covered at 100%. Until we get you back to the point of where you were before the injury. Same for work comp. There are some nuances to that we can talk about, but for the most part, those services are covered. And this is our biggest amount of patients is the private insurance. Blue Cross, United Healthcare, Cigna, Aetna. We're providers for all the major insurance carriers. And the reason we can't tell you how much it costs is because their fee schedules are different, meaning each insurance company covers different services and pays different amounts for the same services. So someone that has Blue Cross is going to pay a different amount then someone has United Healthcare, then someone has Aetna, someone has Cigna, and so on. So that's what we do. We figure out, number one, if we can help you. If we can't help you, figure out what we're going to do to help you, how long it's going to take, and then we figure out with your insurance company, your benefits, what it's going to cost. What's interesting is these patients, these cash patients, are often so worried about how much their costs are, and it's not unusual for a cash patient to pay the same amount or even a little bit less than the insurance patients. Because if you have insurance, but you have a $50 or $60 or $70 copay, or you have a $5,000 deductible, you're essentially a cash patient. So what we do when people come in is we do a consultation. We talk about your problem, we talk about your history, what caused the problem, if you ever had it before. Then we do an examination where we will do certain tests to, actually we want to reproduce the pain. We want to see what's called the pain generator, or what structure in your neck or back or knee or shoulder, whatever we're working on, what's causing the pain so we can effectively treat it. Then we see about getting imaging. If we need x-rays, we need MRIs, we need EMGs, we need any lab work. Then once we get that together, I look it over, and if I can help, we put together a treatment plan where we talk about what we're going to do, how long it's going to take, and then I figure out what the costs are going to be. So you're going to know what your costs are before we start treatment. So there's no surprises. There's no surprises. And to make things easier, we always do a consultation at no charge. So if you really want to know what it costs, come on in, let's do our consultation. Let's see what the problem is. Sometimes I have to tell people, go to XYZ doctor because I can't help this problem, or you're going to be better off going to this provider because they treat this condition better. But if I can help you, then we'll proceed with an examination, x-rays if we need them, MRIs. You'll know exactly what your costs are going to be. And then we'll lay out a treatment plan for you. We're talking about what we're going to do, how long it's going to take, what it's going to cost. And studies show, and my experience shows, it's going to be cheaper and more effective than the physical therapist, than the orthopedic surgeon, than the medical doctor, than the injections. And that's what people want when they come in. What's my problem? Can you help me? What's it going to take? What's it going to cost? Those are the 4 questions people have when they come in. And we're going to answer all those 4 questions for you. And if we can't help you, we'll point you in the right direction, help you find someone else who can. So remember, consultations are at no charge. So we look forward to seeing you soon. And be well.